Welcome back to AfroHealthBridge, where we explore African health traditions and connect them with modern public health knowledge. In our previous episodes, we examined the traditional practice of abdominal scarification in Esan land, how it has historically been used to treat spleen-related illnesses, and the concerns raised by modern medicine and public health research. But this raises an important question. How can we protect communities while respecting cultural traditions? The reality is that traditional medicine has always been an important part of healthcare in many African societies. Long before hospitals and modern laboratories existed, communities relied on herbal knowledge, spiritual guidance, and generational healing practices to treat illness. Traditional healers are often trusted figures within their communities. They are accessible, culturally familiar, and in many rural areas, they may be the first point of contact when someone becomes sick. For this reason, many public health experts believe that the solution is not to eliminate traditional medicine, but rather to build bridges between traditional and modern healthcare systems. One promising approach is community health education. When communities understand the causes of diseases such as malaria and the role it plays in spleen enlargement, they can take preventive steps, such as sleeping under insecticide-treated mosquito nets, seeking early treatment for malaria, and recognizing warning signs that require hospital care. Another important strategy is collaboration with traditional healers. In several parts of Africa, health programs now work directly with local healers, training them to recognize serious illnesses and refer patients to health facilities when necessary. This type of partnership respects cultural traditions while also improving health outcomes. Researchers studying abdominal scarification in Edo State have emphasized the need for community awareness campaigns and preventive strategies, particularly those aimed at reducing malaria infections and improving early diagnosis. Ultimately, improving health in African communities requires more than medical technology. It requires cultural understanding, community trust, and respectful dialogue between traditional knowledge and modern science. And that is exactly the mission of AfroHealthBridge. As we conclude this four-part discussion on traditional abdominal scarification in Nigeria, one thing becomes clear. Health practices do not exist in isolation. They are shaped by culture, history, belief, and experience. For generations, traditional healers provided care in communities where modern medicine was unavailable. Their knowledge formed the foundation of healthcare for millions of people. But today, we have an opportunity to combine the strengths of traditional wisdom and scientific medicine. By educating communities, supporting preventive healthcare, and building respectful partnerships with traditional healers, we can protect lives while honoring cultural heritage. At AfroHealthBridge, our goal is not to judge traditions, but to understand them, and to build a bridge between Africa's medical past and its healthier future. Thank you for joining us on this journey. If you found this series informative, don't forget to subscribe, share, and continue the conversation. Until next time, stay informed and stay healthy.